LBC News.
Now, an abusive boyfriend has been cleared of the manslaughter of his partner who blamed him for her suicide. 30-year-old Ryan Wellings is the first person to be tried by a jury over the death of a partner who took their own life after suffering domestic abuse. Kiana Dawes, who was 23, left a note before killing herself in July 2022. Her mother, Angela Dawes, was speaking outside Preston Crown Court earlier.
I truly hope that no other young lady or child has to go through what he did to my daughter and her baby. And I just wish with all my heart that I could bring her back and say, it's okay, you're safe now.
Now, Ryan Wellings was convicted of assault. We're going to talk live to the founder and CEO of the suicide prevention charity Ripple. Alice Hendy joining me now as attention turns to making sure that something like this doesn't happen again. Alice, this was a truly upsetting case for so many people. It really highlights the need for more awareness, doesn't it?
It does, absolutely. And it's just such a desperately sad story. And my heart really does go out to Kiana's family and friends at this horrendous time. But it also, the story really does highlight and provide us with a reminder on the profound impact that domestic abuse can have on an individual's mental health and their well-being, and indeed the link that exists between such violence and suicide, very sadly. Our charity Ripple has recently expanded its capabilities so that we can intervene online if somebody conducts a harmful online search relating to a broad range of mental health conditions and life challenges, and instead signpost that person to support services relating to that particular challenge that they're going through, and domestic abuse is one of them.
Do you know the extent of this, and how do you intervene and help people, or how have you helped people over the past few years?
So previously, as a charity, we focused exclusively on crisis level searches relating to suicide and self-harm, where people are typing in harmful searches such as how they can end their life, and we instead intervene on those searches and signpost them to support. But now we've expanded so that we're including and incorporating a number of other life challenges and mental health conditions, so that we are providing people with bespoke support in the moment. So as well as domestic abuse, we've got substance misuse, alcohol misuse, financial well-being, eating disorders and so on. But in terms of this particular case, women who experience abuse from a partner are 3 times more likely to have made a suicide attempt in the past year compared to those who haven't. So there's a real link here, and we exist to try and bridge that gap and get people the support they need before it gets to the stage of self-harm and suicide.
Alice, that must be such a challenge for a charity like yourself. Is there any more that the state could do to make sure that people don't feel alone, or they don't feel that there's no one to turn to?
No one should ever feel that they are alone or indeed without options. So it's absolutely our collective responsibility to ensure that help is available when it is needed most, and to make people aware of some of the amazing resources that exist. In Kiana's very sad case, there are a number of resources and charities and organisations from individuals that might be going through something similar. Just to name a few: Women's Aid, National Domestic Abuse Helpline, Refuge, all there to help people. But you're not alone, and there is amazing support out there available for you.
Have you found that people are more willing to share their inner thoughts and are willing to reach out because of conversations like we're having now, and national conversations where people aren't as scared to talk about suicide?
Absolutely. By opening up the conversation, opening up the dialogue between these quite stigmatised topics that we're discussing, for instance, this evening, we are slowly reducing the stigma surrounding these topics. And it's down to us to continue to break down that stigma, normalise the conversation so that people don't feel afraid to open up and ask for support when they need it, whatever it is they're going through.
And we should mention, shouldn't we, that if people want to get in touch with Ripple, it's Ripple with an exclamation mark as the I. That's quite important.
It's a semicolon. It's a semicolon. As the I. The international symbol of surviving suicide. In the English language, it would indicate that the sentence isn't over. And in this case, we're saying that your story isn't over. Keep going.
Alice, it's great to talk to you. Thank you so much for joining us live tonight.
Thanks very much indeed.
That is Alice Hendy, MBE, who is the founder and the CEO of Ripple. That is the suicide prevention charity. You know, if you are struggling, you can visit so many different sites and talk to so many people. Charities like Ripple for more information. The NHS is there as well. Other organisations like the Samaritans. The time is